Hello and welcome to another video section. In this video, I intend to look at some respiratory patterns, some patterns of respiration that is good to know if you are going into clinical practice. So let's begin by looking at the normal respiratory pattern. Now, this is how the normal respiratory pattern looks. You see like a sinusoidal curve. We have on the y-axis, that's the respiratory amplitude, and the time on the x-axis. Okay. So you have this wavy uniform pattern here. Okay. This is known as normopia. Normopia. Okay. Like normal breathing. Anything with P, N, O, E, A at the end is breathing, the normal. So normopia. So that's where apnea comes from. Apnea means absence of breathing. Okay. All right. So keep in mind the normal pattern. This is how it looks like. Okay. All right. Now we have this respiratory pattern known as the biorespiration. It's also known as atasic respiration. It's characterized by periodic breathing, that is of hypopnea. Hypopnea means rapid breathing, or you could have normopnea, which is normal breathing, and then apnea, right? So have apnea, and then followed by hypopnea, or hypopnea followed by apnea, or you can have normopnea followed by apnea, right? So that is a quick shallow respiration followed by regular or irregular breathing. It can be caused by neuron damage. For example, if you have somebody who has stroke or traumatic brain injury, you can have biorespiration, okay, a rapid and an apnea, and rapid or normal, and so on, regular, irregular. Yeah. And this usually has a very poor prognostics. So the outcome is poor, right? That's prognosis, poor outcome here, right? So this is the graph showing the biorespiration. Again, respiration on the respiratory amplitude on the y-axis and the time on the x-axis, right? So you see the period of hypopnea followed by apnea and another hypopnea and then apnea and so on. Or normal, then you have apnea, normal, apnea, and so on, right? So you got to look for patterns of regular and then you have irregular respiration occurring, okay, and then apnea somewhere. So that's a biorespiration. So as we said, somebody has traumatic brain injury, like stroke, can have this pattern of breathing. Okay. Then another pattern of breathing is known as Cosmo respiration or Cosmo breathing. Now, the Cosmo breathing is characterized by hypopnea. It's a rapid, deep breathing. Okay. And this is usually associated with metabolic acidosis. I'll create another video where we will talk about metabolic acidosis, respiratory acidosis, alkalosis, and so on. Okay. Now, but this particular pattern is associated with metabolic acidosis. And what are the causes? You can use this mnemonic to help you remember the causes of Cosmo respiration. So that's it. In the red font, you have Cosmo. So the word Cosmo can help you come out with some of the causes of Cosmo respiration. So the K refers to ketones, presence of ketones in the blood. So somebody who's suffering from diabetic ketoacidosis has a lot of ketones in the blood. So the presence of that can cause Cosmo respiration. Okay. And then somebody with uremia, the U for uremia, uremia can occur if somebody has like liver failure and a kidney failure and so on. You can have uremia, another cause of Cosmo respiration. Sepsis, overwhelming infection, for example, bacterial sepsis. You can have Cosmo respiration. The other S is salicylates, like aspirin, poisoning, and so on. So salicylates can cause Cosmo respiration. M for methanol. So the methanol alcohol, methanol can cause Cosmo respiration. And A, aldehydes. Aldehydes can cause Cosmo respiration. Okay. And then we have the U, which represents nothing here. And then the L, lactic acidosis. So lactic acid, can also cause the Cosmo respiration, right? So Cosmo, if you remember that, it can help you come out with the conditions that can lead to that, the very rapid deep breathing, patterns. Yeah. All right, so we're gonna look at the pattern for Cosmo respiration. You can see here, this is like a rapid deep. So you can see the amplitude, a very high amplitude here, high amplitude, deep, got this amplitude. The maximum displacement from the resting position is the resting position, amplitude, the peaks, high peaks, and rapid. Right, so let's move on to the other pattern known as Cheyne-Stokes respiration. Cheyne-Stokes respiration. So this is a periodic breathing characterized by gradual hypopnea or hypopnea and apnea. Right, so hypopnea, rapid breathing, or hypopnea, so slow breathing, and then apnea. So the person breathes fast, then apnea. Breathe slowly, and then starts breathing. Then apnea, start breathing. Okay. And this can be caused by sleep or hypoxemia. Hypoxemia reduces oxygen in the blood. Certain drugs or hypoperfusion of the brain when there's less blood flowing into the brain, especially to respiratory center. Okay. So then you can have Cheyne-Stokes respiration. So it's associated with, reduced oxygen, supply to the brain. Okay. So that's how we can remember hypoxemia, reduced, blood flow reduced, all about decreased oxygen supply. And then sleep, those who have sleep apnea, for example, they're not breathing well, that can lead to Cheyne-Stokes breathing. So rapid breathing, then they stop breathing, rapid, stop breathing, or it can be slow, and they stop breathing, and then it's slow, and so on. Okay. Cheyne-Stokes respiration. Okay. So let's look at the pattern for that. So this is a pattern for the Cheyne-Stokes respiration. Okay. Rapid apnea, it slows down, and gradual apnea, gradual hypopnea, apnea. So see that pattern, then you're dealing with a condition where there's maybe decreased oxygen going to the blood, hypopnea, hypoxemia, like hypoxemia, reduce oxygen, or hypoperfusion to the brain, or certain drugs, or sleep. Okay.